My name is Tom Herster. I'm a clinical social worker from the Philadelphia area.
My name is Alice Slim. I am a clinical psychology PsyD student at Antioch University, New England.
My name is Lucianne Chen. I'm a Master of Social Work student at Smith College School for Social Work.
I'm Seth Aronson. I'm a clinical psychologist from New York.
There was a very famous book written back in the 70s called Adolescents Grow in Groups. And I think that really kind of summarizes it, that group therapy is a natural format for adolescents because of the interest in peer perceptions and peer support, that they really thrive in therapy groups.
I started group recently, and my observation was that they're really responsive to each other, and they kind of surprise us when they are in the group setting versus an individual setting. I think some of that pressure might be off for them to really just be themselves and communicate.
Yeah, I agree with that. I think that adolescents are really learning to find themselves and become individuals away from their families, and so they're spending a lot of time with their peers, and a lot of times you see that they're really responding better to each other than to adults. So I think that the group format really works well with adolescents.
I think also groups are a transformational space for adolescents. It's where they learn to be with each other. It highlights also the importance of peers for them. And it fills the vacuum that's created when the adolescent is learning to separate from his or her family and be out in the world, and peers and the peer group just fills that. And so hopefully we use the group in a positive way towards helping them. A lot of children and adolescents come to groups to learn social skills. There are social skills groups for kids, but just even as a byproduct of being in the group, there's interpersonal feedback, there's learning how to be with each other. And in our day and age with the new technology and the new media, oftentimes kids and even adults don't always know how to be with each other. And I think group gives them a chance to learn how to do that.
I think too that within a group setting they're really able to process through the issues that they're facing. So especially through school anxieties and family issues, I think that they're able to see that every kid kind of goes through the same thing, and they can relate to each other and give each other suggestions and feedback. And I see that is one of the more powerful parts about the group format, is that they're able to relate and really help each other.
Yeah, I don't think there's a specific diagnosis that it specifically works best for, because I think from my, experience, it's that it's been effective across different diagnoses, and I think what I've observed was that it gives the adolescent to hear many voices and possibly different voices too, and for them to really integrate which jives and sits best with where they are.
I think first of all, what groups do that is unique for all ages, but particularly for adolescents, is it allows people to really look at relationships and relational issues. So most of the youth that I see coming into groups are there because they want to really enhance their relationships and to use those relationships to really help them to understand themselves and to have a fuller life. On top of that, though, groups sort of with kids who have been diagnosed with ADHD or with depression, anxiety kinds of issues, it helps to kind of mitigate against some of the stigma. There's a value to kind of knowing that other kids are like them. Many times all adolescents to some degree struggle with, they feel a little crazy, and it's helpful to really be able to kind of see yourself in other people to kind of help recognize some of the more normative aspects of these struggles.
If you go into any high school or junior high, middle school, kids are always in groups, adolescents are always in groups. And so I think naturally that's what they go to, is they form groups. So you hear about in high school how there's all these different what's the word I'm looking for? Cliques, right? Mm-hmm. And so it's just a natural way for them to be. So I think for them it feels good to be in a room with other teens. I think it's a little more awkward for them to be one-on-one with an adult. So I think it adds to the having them feel a little more natural and comfortable in that environment, and so it makes it a little bit easier for them to talk about things.
And I also think that it allows them to experience the different cliques that they otherwise wouldn't have maybe experienced in their school setting, in a more contained setting where there's a bit more monitoring, and again, to group settings to get feedback from their peers who they may have otherwise not have expected that from.
Yeah, similarly, one of the beauties of group therapy is that if composed in the right way, kids are exposed to kids that they would never spend time with. And so that they can recognize that people from different racial backgrounds, socioeconomic backgrounds, have different lives in their points of both similarity and their points of difference. And I really believe that people grow as much by sort of being with people who are different from them, as well as being with people who are very similar. And that sort of allows them a greater repertoire of engagement and sort of relational behaviors.
And I'd say, adolescents learn so many different things in a group, whether it's interpersonal feedback from each other, from everybody else in the group, from the group as a whole, from the leader. They can also learn what it's like to be in a group and, frankly, a family as a group. So being in a group sometimes has that added benefit of teaching you how to be in a family, in addition to just being in a group, because all families are groups. It's the first group that we're all born into. So there are so many benefits of what goes on in the group, even in just an hour and a half, that hopefully translate into the adolescent's life outside of the group.
So how do parents find a group for their children if they're interested? It can be difficult at times because of groups are hard to get started for many clinicians, and particularly with adolescents, they can be hard to keep going. With that said, though, a good place to start would be the AGPA website, which lists therapists from all over the nation and all over the world, in fact, who are running groups, and they're doing that. In addition, most major urban areas have affiliate societies or groups that are also connected to AGPA with local clinicians, and often listing their work and the kinds of groups they're running. School counselors can be particularly helpful because they often keep a list of people that they refer to, sometimes psychiatrists and other mental health professionals, either through their own knowledge or because they're on listservs, can help people to find a group for children.
The AGPA website is really a valuable resource. I know Tom and I could certainly speak to if somebody from anywhere in the country has a question or they're looking for a group. It comes to us. We're two of the three co-chairs of a special interest group on children and adolescents. We field the question. We then look to see who we know in that area, who we can refer to. We're not going to just refer to anybody. We're going to look to see in membership roster and who we know. Working with adolescents in groups is a challenge. That we have a manual that was developed that calls it the method and the madness and the passion, and there is a lot of passion and a lot of fun and a lot of challenge to it. There's no question that it's a challenge, but it can be extremely rewarding.
And I'll say that I find that many young people who are referred to group often come in with some anxiety and trepidation about it. The idea of sitting down with a group of people you don't know and sharing yourselves is anxiety-provoking. But groups sell themselves, that usually after a child has been in a group for 1 or 2, 3 times, it becomes an important part of them, and they come back. And so they keep coming back because there's a real value to having that kind of support, that kind of feedback, the ability to look at yourself honestly through the eyes of others. As one of my patients has said in the past, the value of this is you're going to be honest with me. You're going to share things because you're not my friends. You're going to share things with me that friends would never share. And that's a real gift. And so kids really get that. And they are fun to do.
I feel like we should also quote our colleague Andy Poyman, who was quoting an adolescent in one of his groups, who said, groups are like showers. I hate getting into them and taking them, but once I'm in the shower, I love it and I don't want to leave.